good? You guys ready? Okay, very good. Good afternoon. I'm Tom Stolz. I'm the county manager for Sedgwick County, and I'm here for our Wednesday update regarding COVID-19. Today is July 8th, 2020. Our numbers, as we roll through national to local, in the United States, we saw a 4.10% increase in COVID cases between today and Monday. So our total today is now above 3 million, 3,016,515. In the state of Kansas, since Monday, we went up 4.2%. So our numbers today in Kansas are 17,618. Our number of Kansas deaths stand at 282. In Sedgwick County, our numbers went from Monday, 1,597 to 1,652 today. That is a 3.4% increase in 2 days. Periphery counties, Harvey County has 55 positive cases, Butler with 78, Cali with 77, Sumner with 17, and Reno with 101. Of the 1,652 COVID cases in Sedgwick County, 768 are counted as recoveries, and we stand at 28 deaths in Sedgwick County. Since the last time I talked with you, which was last Wednesday, we went from 1,278 cases locally to 1,652. That is an additional 374 cases in a week. Represents a 29.3% increase. Our recoveries are not moving as fast as our infections. We went from recorded recoveries of 702 from a week ago to 768 today. That's a 9.4% increase. And very fortunately, our deaths have not increased during that same time period. We had 28 a week ago. We have 28 today. Sedgwick County Health Department is still only testing symptomatic residents in certain high priority professions asymptomatically at no cost. And a high priority profession is those that work in nursing homes or who work with populations of high risk. Thus far, more than 34,000 residents have been tested for COVID in Sedgwick County, and 193 are scheduled to be tested at our drive-through site today. If you are symptomatic or fall under one of those asymptomatic special profession kinds of components, please call United Way of the Plains at 211 to be scheduled for your test. And I want to talk about testing again in a little bit, but let me go through the rest of the presentation first. We've put a new page on our dashboard to show hospitalization data. Every Monday, we have conversation with our two hospital providers, and they give us up-to-date information on COVID patients, the numbers of patients in ICU, and the number of available ICU beds. So that is, if you check our website out, it's www.sedgwick.org, and look, it's the second slide down in the presentation. During the Board of County Commissioners meeting today, we talked about the CARES Act and how the county will receive an additional $9.3 million from the state of Kansas, which will be used to support businesses with the impacts of COVID-19. CARES funding was essentially budgeted today, and the commission approved the budget as we move forward, the $99 million allocation to Sedgwick County. That will also all be online. I will simply mention that $25 million of that has been designated for COVID testing. The commission also today approved an additional 115 positions for the health department to help with testing and track tracing, and they approved another $100,000 for a public awareness campaign that the county started a couple weeks ago, and we will now take to an additional level. They also approved a $101,789 grant award from the Department of Health and Environment for health department's response to COVID-19. So a lot of moving pieces regarding grants and CARES money to handle the pandemic. The testing issue we are having today, and I don't think it's any secret that our local resources are tapped. with the amount of testing that is being requested and demanded. And there's three parts to a testing. There's the front end where people get scheduled, then there's the actual testing piece and the send off to a lab, and then there's the back end where people are notified. And we understand that there's been delays in all facets of this. Our testing centers, our testing labs on a national level and the state level are borderline overwhelmed, and it's beginning to cause delay. So when we do business with national labs, and we have what's going on around the country in Texas and Florida, Arizona, some of our most populous states, naturally that's going to delay results coming back. So Mr. Kaufman today, the Deputy County Manager, asked for those additional 114 positions because we're going to try to throw people at it to start with. We are reviewing technological solutions so that we can put this kind of service online so people can schedule themselves and they can see their results without having to talk to a person. Of course, we have to keep anonymity to that because it's a health matter. And then we also all understand that the only way to turn the corner on this is to get some type of local lab facility, which is why the Commission today approved a potential budget of up to $25 million to improve our testing here. So we are keenly aware of it. We ask for people's patience as they deal with a system today that is very busy and, as I said, borderline overwhelmed. And let's just all be patient and try to understand that these are humans trying to do the best they can to manage a robust system right now. With me today, all of these numbers, all of these facts lead us to our the next speaker here, and I want to bring Dr. Menz in to talk. Dr. Menz is the health officer for Sedgwick County, and he would like to talk about an order today that he is going to push forth. Doctor.
Good afternoon, and thank you for letting me be here to speak today. After reviewing the data and trends of COVID-19 in Sedgwick County, we know the rates of cases and the percent of new cases are trending up. The number of active cases in the health department is currently monitoring is increasing. We know that our hospitals are concerned about the numbers and admissions, and I too echo that. COVID-19 is not going away anytime soon, and we cannot guarantee a vaccine or treatment will be available in the near future, though many are in development. There are things that we can do, however. As a community, we need to stay protected and reduce the spread of COVID-19. The tools we can use currently are, number one, testing. Number two, contact tracing and disease investigation. Number three, wearing masks. Number four, social distancing. And lastly, limiting gathering sizes in our county. Today I'm here to do what I can as the local health officer to mitigate the further spread of COVID-19 in Sedgwick County. I have signed an emergency public health order that will require any person within Sedgwick County to cover his or her mouth and nose with a mask or other face covering in the following situations: inside any indoor or outdoor public space where social distancing of 6 feet at all times is not possible; in line and waiting to enter an indoor public space; obtaining services from the healthcare sector settings; and waiting for or riding on public transportation or while in a taxi, private care services, or ride-sharing vehicle. Additionally, all businesses, organizations, and nonprofits in Sedgwick County must require all employees, customers, visitors, members, or members of the public to wear a mask or covering when employees are working in any space visited by customers or members of the public; employees who are working in any space where food is prepared or packaged for sale or distribution; customers, members, visitors, or members of the public are in a facility managed by the business or organization; employees are in any room or enclosed area where other people are present and unable to maintain a 6-foot distance except for infrequent or incidental moments of close proximity. There are some exceptions to this rule, as we recognize not everyone is able to safely wear a mask. These exceptions include children age 5 or under. Children under the age of 2 in particular should not wear a face mask covering because of the risk of suffocation. Persons with medical conditions, mental health conditions, or disability that prevents wearing a face covering. Persons who are in a restaurant or establishment that offers food or beverage service while they are eating or drinking, provided that they are able to maintain social distancing from other patrons. Athletes who are engaged in organized sports activities or are participating in a strenuous exercise that allows athletes to maintain a 6-foot distance from others. Additionally, Phase 3 of the Ad Astra Plan shall be adopted and incorporated into this order, along with limiting mass gatherings of more than 45 individuals in one location where social distancing is not available. This combination offers the best chance for us to diminish this invisible virus. I've signed this order to take effect at 12:01 a.m. Friday morning, July 10th, and to be in place until at least midnight, Sunday, August 9th, 2020. We are facing a crisis. This COVID-19 pandemic and public health emergency has spread across the county, resulting in illness, hospitalizations, and even deaths. Our schools closed in March, and next year's school year is fast approaching. We ask our business community to temporarily close, which result in lost income and financial hardship for a number of people. Today, the commissioners heard that Sedgwick County had the highest unemployment rate in the state. The actions that the Board of County Commissioners / Board of Health and I take are not done so lightly. We want to keep our businesses open and continue to recover economically. I recognize that our community wants to get back to normal life before the appearance of COVID-19, but it is simply not possible at this time. It is important for our residents and businesses and whole community to come together to protect one another from COVID-19 and also enact measures that will allow us to recover economically. As a longtime medical professional, I know taking these steps will help our community in the long run. We will get through this together, but we cannot get through it unless we all take responsibility to keep our family, friends, and neighbors safe and healthy. Thank you.
We're working off a single podium here today, so we'll do the best we can to answer questions. Either Dr. Menz or myself, and we have Adrian Byrne is here as well. We'll try to answer questions as best we can now. And for those of you viewing, we do have media. When we do these every Wednesday, we have media online with us live. So that's, I guess I'm asking media if there's any questions or if we've covered it sufficiently today. No questions?
I have a
A little bit of audio difficulty here.
no.
Just a sec.
Yes. Oh no, I'm too nervous. You can't seem to hear me. Okay, hopefully they'll just look up that. I sent 3 questions.
The heat off?
Okay, we seem to have audio
No, I
now.
think that's just the person that's making
We're
noise.
getting a lot of feedback, so if you'd mute your microphone until you have a question, then go ahead and ask.
Yeah, you might have to do it.
Okay, and so I'm getting, we're getting some chat. Dion Leffler is saying that he's talking, but we can't hear him. And then there's a question that asked if the county will hire even more people if the numbers continue to rise, and I'll take a stab at that. I think our goal right now is to hire people so we can deal with the issue at hand. Our next step that we want to look at is bringing some type of technology into play, which will allow us to more efficiently take appointments and more efficiently give results back without having to use telephone calls, because that's what's bogging this down to some degree. So on the front end, those are the two solutions that we're looking at, and the county staff and Dr. Mins and people in the medical profession will be reviewing local lab considerations, options for local lab capacity, which if we can achieve that, speeds up that middle process, that testing and turnaround process. So I'm hoping that we won't have to hire anyone more. If we can bring all of these things to bear at the same time, I think that gives us an efficient of a model to move forward with high throughput, high capacity testing, but not going to guarantee we won't. We'll just have to wait to see week to week what the virus does, and we'll make decisions based on that. There's another, while we're waiting on audio to work apparently. On chat it says, is Dr. Min's order mandatory or voluntarily, or I'm sorry, is Dr. Min's order mandatory or voluntary? And the answer to that is it is an order, it is mandatory. And this may be the way we do this whole interview. On the issue of testing, here's another question. On the issue of testing, with the strain on the system, should people get tested when someone around them has tested positive? If that happens to you, I would always recommend that I might have Adrian help me on this a little bit, but it would make sense to contact your physician and talk it through with them. Just because you're around someone who is positive doesn't mean you're what we would call high risk. There's the several minutes of close contact within a 6-foot distance kind of capacity that has to be talked about there. And if you feel like you've been in that kind of situation, you would maybe want to talk that through with physician or talk that through with 211 and try to get in queue for a test. You want to add anything to that? Are you good? Okay. I'm going to have Adrian come up, who's our health director, while we continue to work on audio here. Go ahead, Adrian.
If someone, excuse me, if someone is a close contact, you will receive a letter letting you know that you have been identified as a close contact, which would be, as Tom said, within 6 feet for over 10 minutes, and would recommend that you get tested at that time. If you're not contacted, then that means that you are not identified by the person that's positive as high risk.
Thank you, Adrian. Let me just go down the list here. Will the county commissioners respond and or take action regarding Dr. Min's order? I think everyone understands that the commission can respond. They can modify or change Dr. Min's order. I'm not going to speak for the commission on what they will or will not do. They all are aware of this order today. But I can't answer for each commissioner on how they're going to take action. Please unmute call in user 3. Does that make sense? Somebody's asking you there? Okay.
Yeah, can you hear me?
Yep, we hear you now. Go ahead, sir.
Okay, great. Yeah, this is Don. So how does this change? I mean, we just had a vote last week to not do a mandatory mask order. What's changed since then?
Numbers, infection rate, hospital conversation, all of the dashboard that we watch daily has changed to some degree, and I want to make it clear that this is Dr. Min's order. He has made the decision after a weekend of watching the numbers, and he listens very carefully to the dialogue that the commissioners have. He listened very carefully at last Thursday's special meeting, and that's the difference between last week and today.
Okay, so his order will take effect midnight Friday?
Midnight tomorrow night, yes.
Okay. And that will stay in effect until and unless it's changed by the commissioners.
Stays in effect till August, Doctor, I'm looking at you, August 10, August 9. Tony, you want to come in and do something?
Okay, but don't the commissioners, the commissioners can overrule this if they have the same majority to do that they had last week, right?
That is correct.
Okay.
He said that, I thought referring to governors, but that's what is happening now.
That question broke up. Hold on just 1 second. Let me have a technician take a look at the system here. Stand by just 1 minute.
To our media partners online, we figured out the problem on our end, and we apologize for having all of you muted. That has now been changed. I will ask, though, that when you do not have a question, please mute your microphones on your end, and then when you have a question, please unmute.
Okay, there was a question right at the end that I really didn't understand. If you could repeat that question, something to do with the state or the governor. Okay, while we're waiting on another verbal question, let me read the last one in line here on the chat. For hiring more workers to help with testing, is it due to turnover rates or just the need to have more people to help test? It is the need to have more people help test, particularly the front end and the back end of the system. Scheduling, and specifically on the back end as we're getting results coming in to notify positive patients first, they are the priority, and to give a more timely response to negative patients, some of who are waiting into 10 and 12 days to get results back. And we're just going to try to do better than that. But recognizing that a lot of that delay in that process is because of the testing labs are so overwhelmed that we're not getting results back until 5 to 7 days. Okay, please mute your mics, and then if you have a question, unmute and ask away. Ready for a question?
Just when it comes to numbers, what specific numbers are you most concerned with? What increase specifically has prompted this action right now?
I'm going to have Dr. Menz come and address that. Doctor, he's asking the question of which numbers concerned you the most.
Well, obviously, we're very concerned when the hospital's numbers are going up, because that means we have very ill people being admitted to the hospital, and the hospital numbers have gone up significantly. Also, I'm very concerned about the number of community spread cases we're seeing. In the last month, the number of cases that you contribute to community spread has gone up very significantly. So that means we're having more spread within the community between people. So both those numbers concern me greatly.
Okay, next question. Okay, everything's working. We have no other questions. Everybody's unmuted if they want to be, and we can assume there's no more questions. And there's one note on here. I think someone, did everyone hear Dr. Menz's last question, his answer to the last question? Okay, someone wants Dr. Menz to talk more directly into the mic, so there might be a problem hearing him, but let me know if we need to repeat that answer. Okay. And doctor, let me just summarize, I think what Dr. Menz answered in his last question, what concerned him the most was hospital communications and the number of patients that are on the increase in the hospital. That was number one. And number 2 was the community spread numbers are increasing. That's the number of infections out in the community have gone up rather dramatically. And I think those were his 2 main concerns. Did I cover that right, Doctor? Very good. Okay. Dion, does that help you? Okay. Any other questions, ladies and gentlemen? Okay, we'll be back. I will be back next Wednesday with an update on numbers, and we will see everyone then. Thank you very much.